Hi, today we're in the examination room and we're going to perform an actual Botox injection on our patient, Tara, who also happens to be our medical assistant working in the office. Before each injection, we're going to ice each point before we introduce the small needle. So that will give her very nice comfort level. She may not even feel it. And we'll talk to her as we go through the procedure so she can tell us what she's feeling or not feeling. All right, let's start actually in the center of her frown lines. This area in general, it's called the glabella, and it's actually comprised of two muscle groups. The first one where we're going to be resting is the procerus muscle. The second group, which overlies the bilateral eyebrows, is called the corrugators. How did you do with that first injection?
I did feel it.
And that's the beauty of icing. There's no issues with icing. It's a very fast and painless procedure. Basically, it can be performed over a lunch hour or on the way to work. There's no recovery time. Usually it takes 2 to 3 days to actually begin its effect in resting the muscles of facial expression, in this case, the glabellar or frown lines. By resting these muscles, what she will see over time is she will continue to maintain that smoothness in between and overlying her brows so that she doesn't start to develop lines with rest. So as you can see, we've injected her 5 separate injection points to achieve maximal rest of the glabellar or frown line region. How did you do, Tara?
Perfect.
Okay. So I want Tara first to show us her movement by raising up her eyebrows. And this allows me to determine where exactly on her we need to inject the Botox. All right, so next thing we're going to have Amanda ice the area where we're going to use our little injection. And Tara's only going to have 2 small injection points into her forehead to rest those muscles of facial expression on the forehead. Right there. Usually it takes about 2 to 3 days for the Botox to begin its work in resting those muscles of facial expression. And then she'll be able to enjoy this for approximately 3 to 4 months. We are going to rest the muscles of facial expression right around Tara's eyes. This area is actually called the crow's feet. So it's the little fine radiating lines that come out from the eyes, especially prominent when she squints. So I'm going to have her squint, and these are the muscles that we're going to be resting today. All right, so it's pretty easy, and we'll get started by icing. So we're going to use 3 separate injection points for each eye, so a total of 6 injection points. The needle is very fine, and in fact, we don't have to use a lot of force in order to get the needle tucked under the skin to create minimal discomfort. How did you do on that?
Perfect.
Okay. Did you feel that with the ice?
No, I didn't feel anything.
And that's often what patients say. The crow's feet is one of the more painless areas to inject because the skin is so thin. You don't need to introduce the product deeply. You just need to ice in order to assure the best comfort. I'm holding a little bit of pressure, and I'm going to now change sides with Amanda so she can hold a little bit of pressure, and then we're going to ice the other side. We're taking care in this instance on the thinner skinned areas where we can actually visualize vessels. We're taking care to avoid those vessels, to eliminate bruising of the eye area. Again, it's about 2 to 3 days for this product, Botox Cosmetic, to kick in and begin its work in resting those muscles of facial expression, in this case, the crow's feet area. And that's it.